Hello, I'm Robin Aupperle. I'm a researcher at Lohr Institute for Brain Research and a clinical psychologist at both Lohr Institute for Brain Research and the University of Tulsa. The mission of the Lohr Institute for Brain Research is to use neuroscience to improve mental health. The specific focus of my lab is to better understand how different therapy approaches work, who different therapy approaches might work best for, and identifying novel targets to improve the efficiency or the effectiveness of interventions. Science has always fascinated me as a way of potentially looking under the hood at what factors might be contributing to mental health. I've also always had a frustration with research that does not have direct implications for clinical work or improving people's lives. And so I'm really excited to be at an institute where I can combine a neuroscience perspective with research that really has direct clinical implications. I'll share just a few examples of work from my lab that I hope will have meaningful clinical implications going forward. First, I have an NIMH K23 award that's focused on better understanding how people make decisions to approach reward or to avoid threat, particularly in situations in which both of those are happening simultaneously, referred to often as approach avoidance conflict. Specifically, we're trying to look at how both brain and behavior responses during approach avoidance conflict might relate to how individuals respond to either behavioral activation approaches, in which the focus is on re-engaging people in reinforcing and rewarding aspects of their life, versus exposure-based therapy that is more focused on fear learning or decreasing that avoidance. We're conducting this research in collaboration with Dr. Michelle Kraft, Dr. Willisky Taylor, as well as Dr. Christopher Martell. Preliminary findings indicate that both how people make decisions in terms of their uncertainty in the decision-making process, as well as the dorsolateral prefrontal cortex activation when they're making those decisions, may be important for understanding treatment response to these interventions. So the hope is going forward that if we replicate those findings and further those findings, it could have implications in terms of identifying new targets for novel interventions or for personalized medicine approaches. I'm also working with a colleague, Dr. Akhtiari, in developing a neuroscience-informed cognitive rehabilitation intervention for substance use that is comorbid with mental health disorders. And the focus is on using what we know from neuroscience to actually develop interventions that might help individuals suffering from these disorders. I'm also conducting research that's using a variety of different approaches, including neuroimaging, behavioral approaches, self-report questionnaires, to look at trajectories of mental health in college populations, as well as how we might optimize resilience-based interventions that could be preventative and improve those trajectories of mental health and well-being at that critical phase of life. While neuroimaging is an important part of my research, I don't see it as the most important aspect of my research, and I don't see it as the goal or the end product. Instead, I see it as one part of a broader kind of research goal of developing a more holistic understanding of our treatments and trying to refine our understanding of how cognitive behavioral therapy works and try to provide better understanding of what we can do to improve those interventions going forward.